Device guidelines and insurance companies sometimes leave some patients in a gap when they are potential candidates for an ICD. Well, a new study thinks we should consider the gap and then consider whether the wearable cardioverter defibrillator is perhaps the answer for early post-MI patients at risk for sudden death. I am with the gentleman who wrote the commentary to go along with this JACC paper. It's going to be published, both papers, in the JACC November 19th and 26th issue. It's a combined issue of JACC. And I'm with Dr. Paul Zei, Clinical Associate Professor at Stanford. Okay, you wrote the commentary. It is an issue. I mean, there's definitely this gap between those 3 months. How big of an issue is it?
Well, you can ask that from the perspective of how many patients are potentially affected to if it's a critical issue, because in this situation, the number of patients is relatively percentage-wise small, but the stakes are very high, because if we mistreating these patients, they are potentially at risk for a lethal sudden cardiac death event.
So what is a wearable cardioverter defibrillator?
Right. So this is also known as a life vest by the company that manufactures the device, by Zoll. I have no financial affiliation with them. This is actually old technology. It was approved by the FDA in 2002, so it's been around for over 10 years now. But because of the nature of the disease being treated, there is a real paucity of clinical study data to either support or refute the use of this device. So it's a wearable vest. It has a defibrillator function, and it essentially has a Holter monitor with ECG lead stickers that are attached by wires to the sort of control center of the device to help detect arrhythmias. And if it detects what it considers a potential life-threatening ventricular arrhythmia, it will first give an alert, if you program it such, to allow the patient to abort the event if they think it must be, because I'm feeling fine, it must be an error. Or if not, if the patient's, say, unconscious or feels unwell, then it will go ahead and treat appropriately, hopefully.
Now, Epstein et al. Did the paper. You wrote the commentary. What did you think of the paper?
Well, so as true to their form, it's a very well designed and written paper given the limitations of what they were working with. And what I mean by that is it uses a patient database, so it's not a controlled randomized study, but and in fact, perhaps worse yet, it is a database maintained by the manufacturer of the device. But that being said, it was analyzed reasonably rigorously, and they evaluated patients in that database and tried to essentially mimic the type of patient that you think about in this situation. Essentially, if you're familiar with the Dynamite or IRIS studies, those patients who had recent MI within 40 days, which currently is exclusionary of an implantable permanent device, but with low ejection fraction, the patient that you're worried about.
So where does the wearable defibrillator fit in?
Right, so hopefully under the clothes. but seriously, the wearable defibrillator currently fits in a unclear place, honestly, because the guidelines do not strictly give a clear recommendation on when these patients when patients are appropriate for this. But I'll give you some other points. So it is FDA approved, as I mentioned earlier, and the FDA indications include patients post-MI in whom we think there is a high risk. So that leaves a lot of wiggle room, because what is our definition as a clinician of a high-risk patient? So,
in the Epstein paper, did they make any statements regarding where they thought it fit in?
Well, so yes, in a very conservative way. I think, as they rightly pointed out, their paper was not. They didn't even consider it to be likely the definitive paper to guide management. There is a ongoing and currently enrolling clinical study and registry called VEST, which is hopefully going to be in a more rigorous way able to address this question. But currently, given that how this paper's results come out, I'd say it suggests that clearly, if in that patient population where you do think of higher risk, it is a reasonable consideration.
So for the paper and the commentary, please go to the JACC issue, the combined issue for November 19th and the 26th. And you'll also, I think, find the copy available before publication online. For CardioSource World News, I'm Rick McGuire.